My name is Vijver. I'm a senior researcher at the African Population Health Research Center, the APHRC, and working at the Amsterdam Institute for Global Health and Development.
My name is Charles Agyemang, and I'm based in Amsterdam Medical Center. My main work is basically looking at chronic diseases among migrant population living in mainly the African migrants, and how they compare with the white population, and also looking at how the migrant population also compare with those that they left behind in Africa.
It's an organization that has been founded in 2001 to stop the brain drain of African scientists, and they are mainly working now for the last more than 10 years in the slums of Nairobi. They have a big demographic surveillance site where they monitor health, education, reproductive health and other aspects for the urban poor.
My job is actually entails two ways, both research and also teaching. So I teach in terms of global health, which has been the topic today, and also teach back in many African countries, like particularly in Ghana, where I involve in both universities. So I teach both universities about public health there.
Well, Africa is rapidly urbanizing. In the 50s it was only 15% that lived in cities, but that's going to triple in the next 30 years. So in 20 years more than the majority of the urban African population is living in cities, and that will come up to 1.3, 1.2 billion people. And in Africa, still 72% of the urban population lives in slums. And these people are often ignored. I mean, they have less access to water, electricity, but also public health facilities. And they're also ignored in research and policies.
I think some of the findings has been actually quite remarkable, because I think what you are seeing is that the migrant population appears to have much higher risk of diseases, particularly in terms of non-communicable diseases, compared to those that they left at home. And the typical example is if you compare a study that we look at obesity among Ghanaian migrants compared to those living in urban Ghana as well as the rural Ghana, what you see is that if someone is living in Amsterdam, especially in women, about nearly 95% of them are either overweight or obese, compared to say just about 14% in the rural Ghana. So there's a huge differences between those who are living in Africa and those who are moving abroad.
And now we're talking about NCDs, and more specifically on CVDs. Urbanizing and living in urban surroundings, evidence shows that also involves a lot of increasing risk factors on diet, on smoking, on reduced physical exercise. So there is an increasing risk of cardiovascular disease. But up till now, there's not much research going on and policy to assist these people.
I think the reason has to be several folds, because if as a migrant, once you moved, the first thing that changes is your eating behavior. And usually you think that, okay, I've just moved, relatively sort of richer country. So in the end, you think that, okay, I'm just eating African food, but the way the preparation is completely different from what you're used to in Africa. And also has to come down with stresses. Many people move, they go there with the high hopes. And unfortunately, many people don't make it. So the stresses can force them also to sort of, physical activity no more. They just stuck in their own sort of small community. They don't do any type of activity that can actually help them to improve their health. So there's several factors. And also pressure from home. For many people, once they are there, all the families back at home, many of them also rely on them. So sort of double jeopardy, So there's a tremendous amount of factors which actually predispose them to higher risk that we see among them. But if you ask them, all what they tell you is that it's all in the stress.
Well, we're doing several studies. In 2008, they did a first study to actually measure what is the percentage of blood pressure, what is the percentage of diabetes what is the percentage of smoking and other risk factors. And then they realized actually, although people always thought cardiovascular diseases are for the affluent, in the slums they are there, and people are at risk with significant amount. But they also found out that the problem is with awareness. People are not aware. And that's not just the patients, but also doctors, policymakers, foundations. It's still a subject which is not really taken up. And based on that research, we have developed now a scale-up study together with the Amsterdam Institute of Global Health and Development. And we try to develop, implement and evaluate a cost-effective, feasible and affordable model for prevention of cardiovascular disease for the urban poor. And currently we are implementing that in the slums of Nairobi, Korogocho, in a population of 30,000 people. We screen everyone above 35 on risk factors as hypertension and diabetes, and then we refer them to a clinic. And in the clinic we offer them treatment, and we assist them in the treatment and lifestyle adjustments and try to keep them in the clinic. And then after 1 year we will see what's the impact on the population level and among these patients, and we will also measure how much money it will cost. Because
what I would say to Africa is that, you know, the NCDs or chronic diseases is here to stay. So we need to watch what we are eating. We need to keep some of the African traditions, which is very good for us. You know, the old diet, you need to clearly start, you know, doing a lot of physical activities. And when you do that, you'll be able to beat it. But if you don't and you look at only what is happening in the West, you are in for it.
Well, I would like to say that I think the risk of cardiovascular diseases is that it's something that although you don't have complaints right now, you run a risk in 10 years' time to get a serious disease. So you should take care of your health and try to eat healthy and to try to play sports, walk, and live a healthy life in order to reduce the problems you get in 10 years' time. And that's on an individual level, but I think it's also on a community level and on the country level. So everyone should pick this up and work on this rising epidemic of cardiovascular diseases.